Hey, Pahrump, I'm Dr. Michael Reiner, and
I'm Dr. Creig Christensen. Welcome.
this is a kind of a delayed segment. Hopefully our tuners didn't drop out and go watch something else, but we had trouble. I had trouble getting out of the office. You did too, right? You were really busy.
It was busy today.
Yeah,
very busy today.
Very busy before the holidays, and then of course people getting sick, and you know my staff didn't lock up my office, so I had to do that. I had to do security work tonight. So. Anyway, we're here, and the call-in line should be down there, 727-8750. I guess we can congratulate those conservative people in our groups, those liberal Democrats. I'm sorry, but Trump was officially elected today, correct?
Absolutely.
That's not medical news, but still very important news, right?
Excellent news.
So we're really excited about that. We're going to be probably on the holidays. I think they'll be running some reruns, but I'm going to be on a taping. We're going to tape an interview with one of the new nurse practitioners that's working for us, Melanie Lentz. So stay tuned for that during the holidays and get to see a little bit of Creig and I interviewing her. She's working at my clinic and associated with the Wellness Center. So we want to introduce her to the public. And then you saw Dr. William Creig, and he's been very busy too.
Yes, he's busy.
Yeah. So we have Ray on the phone. Ray, good evening.
Hey, Ray.
Live show tonight. This is incredible. I watched the first 15 minutes. I says, where are these guys, man? Come on, give me a break here. And then all of a sudden you show up. But that's why I stick with it. I know sometimes you show up a little bit late, and so I'm not going to miss out.
Ray, we couldn't disappoint you, Ray. It's Christmas.
Well, thank you very much. You know, I had a lot of thought about diabetes. Most people don't even know what it is, and I'm not sure if I know what it is. Is it basically the ability or the body does not have the ability to get rid of sugar? Is that what it is? And what about all these different things that happen when you have diabetes, like your eyes? You can lose your vision. You have the circulation. You can get amputation. My dad lost a leg to diabetes. He had injured the leg. He just hit it on something and it turned black, and they had to amputate his leg. So if you could explain that, because I think most people don't understand. And also, why do some people have to use insulin injections and others just by diet?
Good question.
Are able to do it. So I'll open the line up, but if you could answer that. And if you start to flounder, like the first segment says, I'll call back later, guys.
Yeah.
Thanks, Ray.
Yeah, we could spend about five shows
on diabetes.
and still never quite cover that particular subject. But I guess to put it in the simplest terms I can, diabetes is a situation where your body loses the ability to get sugar into its tissues. You eat all day long, and so you take in sugar and different forms of sugar, but insulin is a hormone that drives a glucose pump.
Produced in the pancreas.
Yeah, and it's produced in the pancreas by the beta cells, and we are all born with a certain amount of insulin producing cells, and there are I mean, we're getting a very complex subject, but there's type 1, which is insulin usage, and there's type 2, which is adult onset. And some type 1s do progress, some type 2s do progress to type 1, which you need insulin. So that's kind of a mixed bag. But type 1 is an autoimmune disease. Mm-hmm. Your body kills off the beta cells, and they believe there might be a virus, Coxsackie virus, and some other viruses associated with stimulating your immune system. Mm-hmm. And what you see is there is an antibody test that you can do to actually pick that up, but you see this progression at earlier juvenile onset, and then it rapidly kind of progresses as they get into young adulthood. And and then as we get older, we become more sedentary, and we basically have foods, we build fat on our body. You know, Creig talks a lot about exercise and keeping moving, but we develop arthritis and all this other stuff, so we basically don't work out as much. We're not as active as much. And so when we're gaining weight and we're eating foods that are high in carbohydrates.
Yeah, our nutrition plays a major role in that type of diabetes in the way that we
It
eat.
does, and I don't think it's GMO related like a lot of people like to think, but I do believe if you look, there's a chart that I showed on a show a while back ago, and it showed that in the 70s you start to see an obesity epidemic. You start to see
Yeah.
everybody getting obese in the 70s, and following with that was a lot of diabetes research, and you start to see diabetes starting to trail along with it because it's definitely related to obesity. The fatter you are, the more insulin your body has to make in order to drive that sugar. So there's only two metabolically active tissues in our body, okay, muscle or fat, right? And you do not have to have insulin to put sugar into muscle. If you burn it all day long, okay, you can actually control your blood sugar if you were to remain active. And even if...
That's why when people that have it that get active
Yeah.
can reduce their medication intake. A lot of people get off of
Yeah,
their
well, look at
diabetic
the
medication.
people that go through bariatric surgery, right? A lot of them are diabetic or pre-diabetic, and the minute they have the bariatric surgery and they limit their caloric intake to 600 calories and they lose 100 pounds, their diabetes melts away. And it's a very complex structure. So it's not an overabundance of sugar, it's an inability to handle and maintain and deal with the sugar that you have.
So it's
okay?
a metabolic problem.
Yes, it is, and you can control it by diet, weight. But like I said, there's three things you can do. Number one, if you're pre-diabetic, you can do the nibbling diet, because we make insulin every time we eat, and insulin will make fat if we eat and sit. Insulin makes what you tell it to do, because you know the bodybuilders today aren't using testosterone anymore; they're using insulin. Okay, because insulin is an anabolic hormone. So what they do is they do this glucose load, and they eat a lot of sugar, and then they inject themselves with insulin, and then they go work out. And for those of you who do work out, go to the gym, there is a golden window with about an hour after exercise. When you do eat, you will build muscle, okay? But you should not do that anytime. So nibbling diets, like I tell patients, listen, take a sandwich and divide it into quarters. Start at 10, 11, noon, and 1, and eat 4 lunches, really small, and your weight gain will be minimized because of that. And that's what metformin, right? Metformin is this drug that has been out for years, but it's a wonderful drug. In fact, they found that it really limits the insulin spikes. So that's why it's useful in weight loss. A lot of people will put people on metformin because it limits the insulin surges, so they don't make as much fat when they do that. Plus, it's been actually, women are taking it to fight breast cancer.
Is that right?
Yes, because they say it has incredible anti-inflammatory properties. And so it's being used in if you research metformin on the internet, you'll see a lot of off-label uses that are being used with it. And they used to be that they thought it would cause kidney trouble in people that had lower kidney function, but they found out that this it's actually, when we talk about what we call glomerular filtration rate, like 45 or 50 was supposed to be a problem. Now it's all the way down to 30, which is stage 3 end-stage renal disease. You can take metformin, but they won't change the FDA label. Do you know it cost $1 million?
That's what you were saying.
$1 million to change the FDA label. So metformin has these, and since it's generic, nobody's going to pay the $1 million.
Yep.
So Congress is trying to fix that, but you know who knows with the government involved, they could make it $2 million by the time they're done. But
Things are going to change.
yeah, things are going to change, hopefully for the better. But so if you don't know you're diabetic, it's a really simple test. Go to your doctor and let them do a fasting blood sugar on you. And let me tell you, if your fasting blood sugar is between 95 and 140, or make it 130, you're probably pre-diabetic. If your fasting blood sugar is 140 or greater, you're a diabetic. If they do an average blood sugar on you, which is called a hemoglobin A1C, that's a 6-week blood sugar. If it's they lowered it now, 5.6 or lower is normal, okay? So 5.7 to 5.8 is moderate predisposition, mild. 5.9 to 6.1 is mild to moderate predisposition, and then if you're at 6.2 to 6.4, you're very pre-diabetic, and if you're 6.5 or greater, you're diabetic.
So probably the best time to do that would be to stop eating about 7 o'clock at night, don't drink any coffee or juice in the morning,
For fasting blood sugars, yes.
and then go have your blood work done.
And don't use toothpaste. There's a lot of sugar in toothpaste. Okay.
Why don't you briefly hit on the side effects of diabetes, the atherosclerosis, the blindness, the
there's
circulation neuropathies?
There's two types of circulatory issues that we talk about with diabetes. They're called microvascular and macrovascular. So microvascular are small blood vessels, and that's kidneys, nerves, and eyes, okay? And then there's macrovascular, which is your big circulation, heart attacks, strokes, okay? So what sugar does is it makes your cholesterol more permeable to your membranes. I guess that's the short way of saying it. Permeable, that is a big word. But what it means is it makes it really small. So the higher your sugar, the smaller your cholesterol particle, and the easier it is to get into your tissues. So that's why they recommend that if you want to prevent the microvascular events, which means damage to your nerves, your eyes, and your kidneys, you have to keep your average blood sugar at 6 or less, okay? Anyway, we're gonna go to break, and then I'm gonna come back and talk about that macrovascular and the average blood sugar for that. Good question, Ray, thank you. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.